Bismillahirrahmanirrahim. We will start with quote of the day, which is from the Holy Quran. O believers, seek comfort and patience in prayer. Allah is truly with those who are patient. I am Dr. Taimia Ayub, and today I will be presenting the topic of hospital management under the supervision of Professor Dr. Saira Afzal, Dean, Institute of Public Health, Lahore. So this topic is very vast, and we will try to cover all the components of the hospital management. And we will start with the introduction. Hospital management refers to the planning, organizing, directing, coordinating, and controlling of resources in a hospital to deliver effective, efficient, safe, and patient-centered healthcare services. Why hospital need management? Hospitals are complex organization. They have high cost services. Multiple professional groups like doctors, nurses, administration, paramedics are working together. They're working 24/7 operations are being done. High patient expectations and risks are involved. In Pakistani context, public hospitals face overcrowding and limited budget, while private hospitals face cost escalation and regulation challenges. Strong management directly affects service quality and patient satisfaction. So this is a figure showing summary of the functions of the hospital. We will start with the left side. The most important is curative or patient care, which includes diagnosis and treatment of diseases. Then there is preventive function like immunization and screening. Then promotive functions like health education and counseling. Rehabilitation like physical and mental rehab services. Referral function from specialized or higher level care to referral. Then we have community service, outreach and health camps, administrative and managerial function, HR and financial management. Then there is the research aspect by clinical and operational research. Then teaching and training, medical and health professional education, like for example, in cases of hospital which are teaching hospital or tertiary care hospital, teaching and training are involved. And then along with curative, there is diagnostic function with laboratory and imaging services. So this is a clip showing a brief glimpse of the different functions of the what hospitals are performing. Hospital management is the integration of multiple processes. Hospital management connects clinical excellence with administrative and operational precision to ensure safe and efficient patient care. Key functions include overseeing clinical services, administrative coordination, strategic planning, or and regulatory compliance. So, the objectives of hospital managements are to ensure quality patient care, to improve efficiency and cost effectiveness, to ensure patient safety, optimize use of human, financial, and physical resources, ensure compliance with laws, regulations, and standards, and enhance patient satisfaction and trust. So, hospital acts as an organization and it has certain key characteristics like it is a service oriented organization, labor intensive, which is being driven by technology, and high risk environment is there, and there are ethical and legal accountabilities. So now we have different types of hospital like public and private hospital, teaching versus non-teaching hospitals, secondary versus tertiary care hospitals, and specialized hospitals like cardiac, oncology, and trauma. I will explain all these different types of hospitals later on. For example, in Punjab, teaching hospitals are linked with medical colleges, and district headquarters and Tehsil headquarters hospital are working as secondary care hospitals. Healthcare management differs from other industries. Managing hospitals is unique because operations they are operating 24/7. Decisions have life or death consequences. Managers constantly balance quality, cost, and accessibility. They require knowledge of clinical care as well as business administration. So, this hospital governance and leadership. Hospital governance is a strategic oversight. It should be accountability present, policy formulation, and ethical conduct. Then the leadership structure is usually medical superintendent and C or CEO. Then there is also nursing director, hospital administrator, heads of all clinical departments, and so on. Then good governance ensures transparency, accountability, and performance monitoring. Care responsibilities of managers. Hospital management responsibilities typically include personnel management, staffing, motivation, performance evaluation, quality assurance, monitoring standards, safety, patient satisfaction, then regulatory compliance by adhering to laws and accreditation standards, then strategic planning and resource allocation. Successful managers must blend leadership, technical knowledge, and interpersonal skills. So, this is a figure showing hospital management hierarchy. It starts with the top level of hospital management, and then there is middle level hospital management, and then there is lower level of hospital management. So, top level hospital management, we have dean of the hospital, hospital administrator, and specialist surgeons or head of the departments. Then mid level management includes the specialist or consultant, the doctors, the nursing, and then we have lower level of hospital management, which can include physician assistant, medical students, and so on. Organizational communication is critical. Ineffective communication is a major operational risk in hospitals. Best practices include clear handover procedures, structured communication like SBAR, situation background assessment recommendation, regular multidisciplinary meeting to align clinical and administrative teams. Better communication improves safety, reduces errors, and enhances patient experience. So now we come to hospital planning. There are different types of planning involved, like strategic planning, which is basically long-term planning. Then we have operational planning, which is short-term planning or for day-to-day services. And then there is contingency planning, for example, what to do in cases of emergencies, disasters like earthquake, etc. Key planning areas include bed strength, service mix, workforce planning, equipment planning, infrastructure development. For example, in Pakistan, some of the challenges in hospital planning include poor demand forecasting and political influence in planning, which is very common. Human resource management in hospitals. It is important because HR accounts for 60 to 70% of hospital expenditure. Quality of care depends on staff performance. Key HR functions include recruitment and selection, training and capacity building, duty rosters and shift management, performance appraisal, motivation and retention of all the workers. For example, our province, Punjab, is facing issues like staff shortages in peri-urban or in rural areas, uneven distribution of different resources and human resources in urban versus rural areas, and burnout in tertiary care hospitals. So this is a health human resource management functions. It starts with planning, staffing, developing, monitoring, maintaining, managing relationships, managing change within human resource, and then evaluating the working of the different human resource working in hospitals. So, strategic human resource development, ongoing training, and professional development are essential for maintaining quality care. This includes continuing education in clinical and non clinical skills, IT and digital health competency, leadership and teamwork training, periodic performance reviews. Staff development improves morale, retention, and client outcome. Now we come to financial management in hospitals. The main objective of financial management is financial sustainability, cost control, efficient resource utilization. It includes key components like budgeting, line item versus program based, costing of services, revenue generation, and financial audits. For example, public hospitals are in Pakistan government funding and they have limited financial autonomy, whereas private hospitals are user-free based, insurance payments based, or profit-driven, but which should be regulated. So this is a diagram showing financial management. At number one comes budget, then there is financial strategy, then there is cost control, financial risk, and finally, if the profit. This is another diagram showing hospital finance management by inventory, OPD centers, appointment, pharmacy, financial aspect, security, IPD, infection prevention control center, and receipt and bill. Now we come to another important part of the presentation, which is about explaining different types of hospitals and how they can be classified in different types. Hospital can be classified in several ways based on ownership, function, level of care, length of stay, and specialization. Understanding these types helps us in planning, management, and policy formulation. So, first of all, this is a figure showing a brief summary of the types of hospitals. So, they can be divided based on ownership or management, based on teaching status, length of stay, system of medicine being taught in those hospital, size depending upon bed strength, length of stay again, and status whether they are teaching or non-teaching, then population, are they serving urban population or rural population? And what is their function, general function, or they are specialized hospital, or level of care by primary, secondary, or tertiary care. So, for classification by management or ownership, we have public government hospital, which are owned and funded by federal, provincial, or local governments. Their characteristics include providing services at free or subsidized cost, serving large population, focusing on equity and access. In Pakistan, include teaching hospitals of government side, district headquarters, DHQ hospitals, and Tehsil headquarters hospital. Challenges include overcrowding, limited resources, and bureaucratic concerns. Then we have private hospitals which are owned and managed by individuals, trust, or corporate bodies. Characteristics include fee for service model, better infrastructure and amenities, greater managerial autonomy. Challenges are there is very high cost of care and limited access for low income group. Then we have autonomous or semi autonomous hospitals, publicly owned but with administrative and financial autonomy. Advantages include faster decision making, improved efficiency, and better accountability. Now we come to classification by level of care. We have primary level hospital, which provide basic curative and preventive services, handle common illnesses and minor emergencies. For example, BHUs or RHCs. Then we have secondary level hospitals, which provide specialist care, act as referral centers from primary facilities, and they include THQs and DHQs. And finally, we have tertiary level hospital, which provide advanced and specialized care, serve as referral centers for secondary hospital. Examples include teaching hospitals or specialized institutions. Finally, we have classification by function. We have general hospitals and specialized hospital. General hospitals provide a wide range of services: medicine, surgery, pediatric, obstetrics, and gynecology. Their role is they act as backbone of hospital services. Then we have specialized hospital, which focus on a specific disease or system. For example, cardiac hospital, cancer hospital, orthopedic hospital. Advantage is that there are better outcomes for specific conditions and their expertise level are high. Then we have classification by teaching status. For that, we have teaching hospitals which are affiliated with medical colleges involved in teaching, training, and research. Characteristics include complex caseload, multiple trainees, and higher operational cost. And on the other hand, we have non-teaching hospital, which focus mainly on service delivery, less complex organizational structures are present. Then we have classification based on length of stay, short stay or acute care hospital, which treat acute illnesses and emergencies. Patients stay for a very short duration. Examples: general hospitals, emergency care hospital. Then we have long stay or chronic care hospital, which manage chronic illnesses or rehabilitation. For example, psychiatric hospital or rehabilitation centers. Then we have classification based on size, mainly bed strength. Small hospitals up to 100 bed, medium hospitals from 100 to 500 beds, large hospital which are about for more than 500 beds. And management implication is that large hospitals require complex administrative systems and specialized management teams. So now we come to hospital departments and function. Hospital can have clinical departments like medicine, surgery, pediatrics, obstetrics, ICU, emergency. Then they have diagnostic services, laboratory, radiology, blood bank. Then there are supportive services like pharmacy, CCSST, laundry, kitchen, transport, and housekeeping. And effective coordination among departments is critical. Hospital operations management, key operational areas are hospital OPD management, emergency services, bed management, ICU utilization, OT scheduling, and patient flow management. Common problems in Pakistan include overcrowded OPDs, long waiting time, and poor referral systems. Now we come to performance monitoring and KPIs. Key performance indicator measure and improve performance. Typical KPIs include bed occupancy rate, average length of stay, patient wait times, clinical outcome indicators, and patient satisfaction. Tracking KPIs enable managers to identify inefficiencies and target improvements. So, this is another figure showing healthcare KPIs. These are key metrics which can be used by healthcare provider to determine quality of care their patients are receiving. For example, rate of patient no-shows, patient satisfaction, connection quality, patient wait time and travel time, and successful encounters. So these are some of the examples, but there can be many different aspects of KPIs, and they act at different level and from different perspectives. So, patient centric care focus. Hospital strategies should always align with improved patient care and outcome. This first culture improves satisfaction, encourages adherence to treatment, reduces readmissions, enhances reputation and utilization. Hospitals that integrate clinical excellence with patient experience excel in both outcome and efficiency. Quality assurance and patient safety. Quality in hospital means doing the right thing at the right time for the right patient in the right way. Patient safety measures include infection prevention control, medication safety, surgical safety checklist, and incident reporting systems. For example, if there are hospital acquired infections or if there is need for standardized standard operating procedures. Now we come to another aspect, which is Hospital Information System (HIS). The main role is for the patient records, billing, inventory management, HR records, and decision support. Benefits are that it leads to improved efficiency, better monitoring, and reduced errors. For Pakistan, there is partial digitalization. DHIS2 is mainly used for reporting, and HIS implementation is uneven. We will be explaining DHIS2 in the coming days. Hospital supply chain and inventory management. The key areas include procurement, storage, distribution, and stock control. Common challenges include stockouts, expired medicines, and weak forecasting. Best practices include to always have essential medicines list, centralized procurement, and inventory audits. Legal and ethical issues in hospital management. Legal aspects can be about patient rights, consent, negligence, documentation, or medical legal cases. Ethical principles which are always there are autonomy, beneficence, non maleficence, and justice for the patient. Hospital managers must ensure compliance with all these legal aspects and ethical principles at all times. Hospital accreditation and standard. This is another very important topic to ensure quality care in hospitals. The purpose is to improve quality, ensure safety, and standardize care. Common standards are based on national standards or international accreditation system. In Pakistan, there are some hospitals which are showing growing interest in accreditation, but unfortunately, in public hospitals, the process is still a bit lagging behind. So now we come to ISO accreditation, which is an international organization of standardization. Accreditation means that a hospital's management systems and processes meet internationally agreed standard for quality, safety, and continuous improvement. Key points is that ISO focuses on how the hospital is managed, not on clinical outcomes alone. Certification is granted by an accredited certification body after audits. It emphasizes documentation, standard operating procedures, audits, and continual improvement. Common ISO standards used in hospitals are ISO 9001, quality management systems, most common in hospital, ISO 14001 for environmental management, ISO 45001 for occupational health and safety, ISO 27001 for information security. ISO helps hospitals standardize processes, reduce errors, and improve patient satisfaction, but it is not a clinical accreditation. Now we have some other accreditation, for example, JCI accreditation, which is also known as Joint Commission International. The scope is that it is global, clinical quality focused accreditation. Strengths are that the patient safety goals, clinical governance, and medication safety, along with infection prevention control. It is used by large tertiary care hospitals and private hospitals. The cost for maintaining or for getting this accreditation is quite high. In Pakistan, there are several few hospitals which have achieved this accreditation. For example, Shaukat Khanum Hospital and Pakistan Kidney and Liver Institute, along with a few more. National Accreditation Board for Hospitals and Health Care Providers (NABH). Its scope is about comprehensive hospital standards. Strengths are that strong clinical plus managerial balance. It is used by hospitals in South Asia, often a regional alternative to JCI. Then we have Punjab Healthcare Commission. It is about mandatory licensing of minimum service delivery standards (MSDS) in Punjab. Strengths are that it is about patient safety, infection control, and staffing. Status is that regulatory licensing rather than international accreditation. And the trainings are being given at Institute of Public Health about MSDS from Punjab Healthcare Commission in collaboration with IPH faculty. Then we have Pakistan National Accreditation Council (PNAC). Scope is that it accredits certification bodies and laboratories, not hospitals directly. Its role is to ensure ISO JCI certifiers are credible in Pakistan. So, this is a brief summary explaining all the standards which I have just explained. So, this is showing at in which areas the main focus on these accreditation or standards are, and whether they focus on clinical care only or management system or both, and what is their relevance in uh, context of Pakistan. Now we come to another important aspect of management of hospitals, which is the emergency and disaster management in hospitals. Hospital preparedness. Hospitals must always be prepared for disaster management, mass casualty management, fire safety, and infection outbreaks. For example, in Pakistan, we had to face these disaster management in hospitals during COVID-19 times. It also occurs occasionally in dengue outbreak, and then there is the flood emergencies which are there. So this is an infographic which is showing the emergency plan about urgency, ambulance services, first aid services, rescue, and then healthcare workers, how they respond. So this is brief summary showing what are the different challenges in hospital management in Pakistan. We will start with the left side, which includes the main challenges, which are the resource constraint. In Pakistan, as a government is only spending 0.9% of the total budget on healthcare, which is very less as compared to the recommended World Health Organization standard of 5%. And the current strategy is to increase at least this budget from 0.9 to 2%. This is the main goal for the coming few years. Then we have short staff shortages by lack of health professionals and burnout in healthcare professionals, limited managerial training, weak leadership and management skills, and infection control issues, which leads to hospital acquired infections. Political interference, unfortunately, is there, which influence on staffing and resource allocation, weak referral system, poor coordination between services, staff shortages, lack of health professional, in unequal presence of healthcare professional in rural versus urban areas, and so on, and overcrowding, which is another major issue with high patient load, which leads to long wait time, etc. So, the future directions must include strengthening hospital leadership, professional hospital administrators, digitization and HIS expansion, quality and patient safety culture, and public private partnership, and encouraging the public private partnerships. Now we come to multiple choice question part of the presentation. So we will start with the first MCQ. A tertiary care hospital in Lahore reports multiple adverse events due to incomplete information during shift changes in the ICU. The medical superintendent wants to introduce a structured communication protocol. Which intervention is most appropriate to reduce clinical handover errors? A. Increase ICU staffing numbers. B. Introduce SBAR based handover protocol. C. Penalize staff for incomplete documentation. D. Reduce ICU admission rates. Or E. Conduct annual communication workshops only.
D. C.
Um, Basically, it should start with introducing option B, introducing SBAR based handover protocol. That should be the first step, followed by communication workshops, and the panelizing staff should be the last resort. A DHQ hospital in Punjab faces persistent staff burnout, frequent sick leaves, and declining patient satisfaction. HR expenditure already accounts for 65% of total hospital cost. Which strategic intervention would most sustainably improve performance? A. Structured performance appraisal with continuing professional development. B. Immediately salary increase for all the staff working in the hospital. C. Recruitment freeze to control expenditure. D. Outsourcing clinical services. Or E. Reducing night shifts.
A.
Yes, it should be structured performance appraisal. A public teaching hospital is transitioning from line item budgeting to program based budgeting. What is the primary advantage of program based budgeting? A. It eliminates government oversight. B. It links financial allocation to service outputs and outcomes. C. It reduces HR expenditure automatically. D. It increases private insurance revenue. Or E. It decentralizes procurement completely.
B.
Yes, linking financial allocation to service outputs. A hospital is publicly owned but has independent authority over financial decisions, procurement, and HR recruitment. This hospital is best classified as a private hospital, B public hospital, C corporate hospital, D NGO running hospital, or E semi-autonomous hospital.
E.
Yes, it is a semi-autonomous hospital, right? An urban public hospital has severe OPD overcrowding, long wait times, and inappropriate self-referral to tertiary care. Which systems level intervention would most effectively address this issue? Expanding OPD infrastructure, increasing OPD consultancy fees, reducing OPD operation hours, strengthening primary care referral mechanism, or introducing VIP patient counters.
D.
Yes, it includes strengthening primary care referral. A secondary level hospital has partial digitization. Patient records are paper based, while DHIS2 is used only for reporting aggregate data. Which additional HIS component would most directly reduce clinical errors? Automated billing softwares, digital inventory management only, electronic health records with decision support, or payroll management systems, or SMS appointment reminders for all the patients.
C.
Yes, it is. Electronic health record should be starting. Then a hospital obtains ISO 9001 certification. However, clinical outcomes such as surgical site infection rates remains unchanged. The most appropriate interpretation is that ISO certification guarantees improved clinical outcomes. ISO certification primarily focus on management systems and process standardization. ISO certification replacing national accreditation requirement, or ISO eliminates needs for clinical audits, or ISO accreditation only focuses on patient satisfaction.
B.
Yes, ISO accreditation primarily focus on management systems. During a flood emergency in Pakistan, a district hospital becomes overwhelmed with trauma cases. There was no predefined mass causality triage system. Which preparedness element was most critically lacking? Disaster management and mass casualty plan, fire safety protocols, hospital accreditation status, financial audit system, or OPD appointment scheduling system?
A.
A.
Yes, it is A. A hospital aims to reduce readmission rates and improve patient satisfaction. Which KPI combination would best reflect patient-centric performance? Bed occupancy rate and revenue generation, staff to bed ratio and procurement cost, average length of stay and readmission rate, number of outpatient visits, or number of staff trainings conducted.
C.
C.
Yes, it is C. Yes. A provincial government plans to improve hospital efficiency without privatization. Evidence shows bureaucratic delays in procurement and HR hiring. Which reform model is most aligned with improving efficiency while maintaining public ownership? Full privatization, outsourcing all services, reducing bed capacity, conversion into autonomous hospital, eliminating regulatory compliance.
D.
This
B.
it is C, by reducing bed capacity while maintaining. Yes. In my key, it is C, but I will still check it. So, this is the YouTube link where this video will be uploaded, and thank you very much for listening.